This is another case for an amalgam filling. Of course, it's a defective filling. But this is not our topic now. What we want to know here is the radiographic appearance of the amalgam filling. Here, you can see that there is a DO filling in this lower, apparently lower 6 or 7. And you can see that the amalgam filling over here, the DO filling, this is the occlusal part and this is the distal part of the filling. It appears quite radio opaque. Compare it to the radio opacity of zinc phosphate cement. You can see, of course, because zinc phosphate cement, the radio opacity is much less, but however you can see it, but it's apparent that the two materials differ in their radio opacity. Another case of an amalgam filling in a root canal filled upper 6, where you can see that the amalgam filling, actually these fillings are, it's a big filling, as you can see. It's an MO filling, and the filling actually has gone to fill most of the pulp chamber. Sometimes some dentists would go to this choice by filling the whole pulp chamber with the amalgam filling. Compare the radio opacity of the amalgam to that radio opacity of enamel. Of course, it's much higher, and compare it to the radio opacity of the gutta percha of the filled tooth. Here we cannot see the liner because of either of the superimposition or because there is no liner at all. It's just an amalgam filling that is placed into the pulp chamber. Another tooth, lower 6, which is root canal treated, and here you can see the amalgam filling. There is a amalgam filling. We can hardly say it is an MO filling because it's not that, it doesn't fall under the category or category of an MO filling. However, there is a large filling on the occlusal surface, and then there is another separate amalgam filling that is present on the distal surface of the tooth. The two fillings are apparently either broken filling or it is two fillings that were incorrectly placed. Anyways, this is an amalgam filling, and just underneath the amalgam filling you can see that there is a material which has a relatively higher radio opacity than the radio opacity of the gutta percha filling. This material is mostly the temporary filling that has been left over, part of it, the zinc oxide eugenol. Usually it is as an interim material that is left, placed in between fillings or before the final filling. So what dentists do, some cases, they leave some of the zinc oxide temporary material which hardens, and then it is used as a liner for the amalgam filling. The rest of the filling is gutta percha, and you can see the radio opacity of gutta percha compared to the zinc oxide eugenol liner, and compare it to the radio opacity of the amalgam on the other side. Here we can see that this is an amalgam filling over here, and there is no liner underneath. By the way, the liner in some cases, especially in open margin or old fillings, all amalgam fillings, due to the micro leakage, zinc phosphate cement tends to resorb by the oral fluids, so you don't see always the liner or the subliner present underneath the filling. So it is either you can see it for different reasons. Either it is the amalgam filling superimposes the lining material, or it is very thin so that it doesn't cast a shadow, radio opaque shadow, or sometimes it simply dissolves in all the filling. What I want you to compare here is the relative radio opacity, or the high radio opacity, between amalgam filling and to that of composite. See, composite also is radio opaque, but it has lesser radio opacity if it is compared to the radio opacity of amalgam, and it has a higher composite has a higher radio opacity than that of gutta-percha. Okay, so again, this is because of the content of the material. Now compare both of the amalgam and the composite to the this crown, which is it is, as you can see here, it is PFM, that is porcelain fused to metal. Now this is the metal part of the crown, which is very radio opaque, depends what type of metal that has been used, and it is very radio opaque. It is more even radio opaque than the amalgam, of course, definitely more than the composite. And as you can see here, that this is the porcelain, which is fused to the metal, which forms the final layer of the crown. Now you can see that porcelain has lesser radio opacity than composite, and it has a lesser radio opacity than amalgam, and lesser radio opacity than the metal core of the crown. However, it has and even the radio opacity in this radiograph of porcelain is less than the gutta-percha of the root canal filling. In this in this radiograph, we can see multiple fillings. One, we can see a composite filling over here, a DO filling, a root canal filling. See the gutta-percha, the radio opacity of gutta-percha to the composite. In this tooth, we can see that there is an amalgam filling, a very big MOD filling, amalgam filling with a prefabricated post screw. See, these are the threads of the screw that has been threaded into the palatal root canal filling, which is usually, because being it is the largest canal, so the screw retainer actually is threaded inside the palatal canal. So what we can see here, amalgam plus the prefabricated screw post, and we can also see that there is a root canal filling in the tooth. Now compare the radio opacities of the amalgam, which is more than the screw, and it is more the screw radio opacity. The radio opacity of the screw is more definitely than the gutta-percha. If we look at the 7, we will see that there is an MO filling, amalgam filling, and you can see here that this is the liner of the material, mostly the zinc phosphate cement. So we see 3 different or 2 different materials: composite, amalgam, okay, and cement. And we will see the retaining screw, the threaded screw that is present in the root canal filling.